As companies work toward FDA approval of vaccinating children younger than 12 for COVID, some question how necessary it is since they're at a lower risk of severe infection.
They're not high risk, but they're not no risk.
Dr. Bobby McCamala of Flint says risk factor is only one of the considerations when deciding to vaccinate.
Just like, the risk of, dying from measles is low, but it's not zero, and we get vaccinated for that.
He says children can also be vectors of COVID-19, unknowingly carrying the virus and putting others at risk.
And it doesn't take much to put an 85-year-old grandparent or great-grandparent just sick enough to end up in the hospital.
Dr. McCamala points out that across the U.S., hundreds of children have died from COVID and several thousand have been hospitalized.
And what we're also seeing is that when kids do get hospitalized, they're actually sicker than adults when they end up needing hospitalization.
A COVID-19 vaccine for children under 12 is expected to be available by fall, just in time for the school year. Members of the Food and Drug Administration Committee believe a vaccine is needed for adolescents and children. But
I want to be sure that the risk of the vaccine is less than the risk of hospitalization.
And considering the apparent effectiveness of Pfizer's vaccine for kids 12 and older, there's hope.
We have a very well-established regulatory precedent for demonstrating effectiveness in pediatric populations.
I'm Jamie Sherrod, WNEM TV5.